Dr. Tracy Tyson, board certified general pediatrician, and I want to talk about newborn visits. What are they like? Why do we do them? And what are we looking for? So after your baby is born, your medical providers in the hospital or birthing center, wherever you deliver, will recommend you see your primary care provider within a certain amount of time. This is usually anywhere from 24 hours to 72 hours, depending on how fast your baby is discharged home, if there's any medical risk factors, and how they're doing in the hospital. So that first visit looks a lot like this. We do a pretty detailed history where we find all about your pregnancy, delivery, we ask about risk factors, we find out how the baby did in the hospital, and then we talk to you about how you've been since you got home. So we ask a lot of questions about feeding, if the baby's breastfeeding or bottle feeding. We ask a lot of questions about how much they peed and how much they poop. So let's talk about what's normal. So what is normal in a newborn those first few days when you get home? Expect the first night to be pretty rough. It always is. I feel like babies are super tired that first day or so after delivery, and they actually nurse really well. And then all of a sudden they get home, they forget how to nurse, they scream their head off, and it's like, what happened? Where was the baby I had in the hospital? This is normal. It's just because they're starting to wake up, they're starting to have all these sensations they've never had before. They've never been hungry, they've never been tired, they've never been cold, they've never been really wet from a diaper when everything else was dry. So everything is new to them. So that first night home can be kind of rough. Just expect it, understand it. If you're nursing, nurse them as often as you can. Wrap them up super tight so they feel comfortable, and just call us if you need us. So just knowing that that's normal. How much should babies be peeing in those first few days? The typical rule of thumb is that for every day of life, the baby should have that many wet diapers. So on day 2, they should have at least 2 wet diapers. They can have more, but at least 2. Day 3, they should have 3. Once they get to day 7, all bets are off because they're pretty much peeing every time you feed them. But that's a good rule of thumb. And one question that we will ask you is, how many wet diapers has your baby had in the last 24 hours? Bowel movements or pooping is all over the place. Babies are born needing something in their intestines called meconium, which is a thick, black, sticky substance that needs to come out in the first day, 1 to 3 days of life. After that, it turns into a transitional poop, which is kind of an army green, liquidy, sometimes seedy if you're breastfeeding, kind of poop that lasts for a day or so. And then you start to see that yellow, mustard color, watery, seedy stools in babies after that. Sometimes after the meconium is out, babies will not poop for 24 hours, sometimes a little bit longer, completely normal. Babies are not getting a lot of food in the first few days of life, and they're getting a little bit dehydrated. So they get dry, so the body's pretty smart, and it hangs on to any extra liquid. Breast milk especially doesn't have a lot of waste associated with it, and so babies will kind of hold on to everything that they need. Then once they get more hydrated, you'll start to see them pooping more. So feed your babies as much as you can. They cluster feed every 30 minutes, every hour, every 2 hours, so that they kind of get your breast milk supply up so that they start peeing and pooping better. We also take a look for jaundice. And so all babies have a little bit of jaundice where they turn orange and yellow, and that is because there's too much bilirubin. When they start breaking down their red blood cells after birth, certain levels of bilirubin are fine and expected, but getting over a certain level used to cause problems in the brain and neurological problems later on. So once we started checking for it and screening for it and preventing these complications, it's almost unheard of in the United States. So your doctor's also going to ask you about jaundice and take a look at your child, make sure they don't need their level checked. The more they feed, babies get rid of bilirubin from their skin and their pee and their poop. So a little bit of indirect sunlight while you're doing skin-to-skin contact and lots to eat is going to help them pee and poop. So we're also going to ask you about something called social determinants of health. We're going to talk about your family. What do you do for a living? Who are the people you're getting your information from? So we know how we can best tailor our information to you. We want to make sure you feel seen and heard. And what we're seeing now, that there are so many less medical complications with children with modern medicine, we're seeing a lot more social causes of medical problems in kids. So you're going to get a lot more detail, like, how are you doing? What's your social support? What can we do to help? In my office, we use something called Dulce, which is where we have a family support person who is assigned to all newborns 0 to 6 months of age, where we screen for these social determinants of health to see if we can't help support the family. Because studies show in that first 6 months of life, the health of the family equals the health of the child. So I hope this helps break down some of the curiousness about what happens in the newborn period. And take care. Good luck.